while I was doing some work on Ebola, I saw this child in an hospital in Nord Kivu. So this child was around 10, 11 years old, extremely underweight, and he was approaching me to beg for some money. He told me that he had diabetes and actually he needed this money to buy the dose of insulin that he needed for that day. And then I went to check in the hospital with the doctors in charge of the diabetic patients if there were other patients in a similar status. And actually the doctor told me, confirmed that he had around 30 patients a week consulting for diabetes. There were other children in the community with diabetes. They were not even going to visit the hospital because they couldn't afford both transport to reach the hospital or as well to afford treatment, access to insulin.
So normally patients have to walk, some of them quite a significant distance, 2 kilometers, 3 kilometers to come to the hospital almost twice daily to get these insulin injections. So the distance is actually one thing that is frequently reported by patients too, that it really impacts a lot in their daily living. To be honest, if insulin could be given, for example, in a tablet or a patch, and for example, once a week, this is really what we are dreaming for. If you look at it, you remember that one of the things that I have pointed out as challenges, the distances, the time where a patient has always to think about coming to the hospital. If you look at it, all these can really be eliminated with what I would call like a simplified regimen, and a regimen that will make it possible for a patient to administer their treatment on their own. And then it will eliminate this part where they always have to think of the hospital. They always have to think of injections. They always have to be reminded of their disease. And in a way, maybe it will give them back a sense of life and a quality of life that will really also be improving. And even it will help even the healthcare system in terms that now you'll have patients able to just take a tab at home and you don't need to think about the cold chain storage system, the syringes to inject. So it will be a really a nice thing.
I think as a public health doctor, as part of a community, we have a treatment for diabetes. We have a duty, responsibility to make sure that those patients are not left behind, that those patients are not forgotten. We should ensure that they have access to safe treatment. The child should be an happy child, going to school and not roaming around begging for a right. Has the right to be healthy. There is drugs available. We should make all the effort possible to ensure it. Thank you.